Hi, I'm Dr. Kevin Cheng, founder of Osana, a health service dedicated to transforming lives through prevention. Over the years, I have reflected with colleagues on what we wish people did so they can avoid pain, surgery, or developing a chronic disease. Often the answer lies in embracing a proactive mindset and putting healthy lifestyle practices into action. By doing this, the upside is not only better health, but also saving us time, money, and stress in the long run. In this podcast, I'm joined with my friend Saxon Piggott to chat with a new health expert each week. We'll cover practical ways to look after ourselves, how to prevent illness, and ways we can be inspired to live well. Welcome to Prevention Hacks, the weekly conversation where we go to health experts for advice, so you don't have to. Welcome, Carolyn Ee, clinician and academic. You're chair of Australian College of GPs Integrative Medicine Committee, and welcome to the Osana podcast.
Thank you for having me.
Carolyn, can we start just by asking, what is PCOS?
That's a great question, Saxon. So PCOS is Polycystic Ovary Syndrome. It is a hormonal disorder that affects about 10% of women worldwide, and it can result in a number of, manifestations that will trouble women. So they are menstrual or reproductive issues, so issues around periods being very irregular, and some associated difficulty falling pregnant with that. They are effects on male hormone levels. So women with PCOS have high levels of testosterone, and that can show as a lot of acne or pimples, or hair where they don't want it to be, so on the chin or the back or the tummy. And sometimes polycystic ovaries might show up on an ultrasound, indicating that there are too many follicles on the ovary, and those create the hormonal problems that we see.
Is it on the rise, Carolyn? Since we've studied together in medical school and 20 years being a GP, I seem to see more of ladies with polycystic ovary syndrome. What are the stats?
Yeah, look, I think there's two things happening there. So one thing is that we're much clearer about the syndrome and what it is and how to diagnose it as well. So particularly in the last 5 years where there've been more international guidelines on the area. So I think we are diagnosing it more, but also it's a syndrome that's associated with excess weight. So excess weight will make all of those symptoms more pronounced. And in fact, if you lose weight, you'll probably lose the syndrome. So you won't have the high levels of testosterone and your periods will tend to normalise. So I think with the rising rates of weight and obesity, we're probably going to see more and more PCOS being diagnosed.
Sure. And what is the, what is the inflammation basis or the lifestyle basis to what causes PCOS?
Yeah, no, that's an interesting question because lifestyle changes are really kind of the cornerstone of treating PCOS. So even if you're not overweight, we do recommend changes in lifestyle. And there's no sort of specific diet that's helpful for women with PCOS, but things like the Mediterranean diet, for example, have been shown to be important in terms of helping to reduce weight and helping to reduce the symptoms. So we think that, with any other lifestyle-related disease, the more weight you gain, the more meta-inflammation you get, so the more kind of metabolic inflammation or inflammation from excess fat cells, and that can make all of your symptoms worse.
It's a common thread that we hear a lot in these podcasts that being healthy and leading a balanced lifestyle and doing all the right things, exercising and whatnot, tends to keep people on the right path and stop a lot of these things from occurring. Is that the case here?
absolutely the case. So we know that there's a very small sort of calorie intake difference between women who have PCOS and women who don't have PCOS. Even that very small increase in calories every day obviously makes a big impact overall. Another thing that we found by talking to women with PCOS about the barriers to losing weight is that women with PCOS tend to have a negative view about their ability to lose weight. So there's kind of something that holds them back, where they think, I can't lose weight, it's harder for me to lose weight. There's also associated mental health issues with PCOS, so anxiety and depression symptoms are more common. So we think that perhaps these might be sort of underlying the reasons why women find it harder to lose weight, because they're setting out with a mindset where it is going to be harder for them. And we do see them struggle. And I think women with PCOS do need additional help and support from exercise physiologists and dietitians, and setting out with the positive mindset that, with lifestyle changes, weight loss is achievable, and, the fertility improves, their symptoms of acne improve, and they do feel much better overall psychologically.
What happens if it goes untreated?
Yeah, look, a lot of the times it does actually go undiagnosed. So we're trying to increase the rate of diagnosis. We know that a few years ago, women were presenting with symptoms and it took more than 2 years to be diagnosed. If it goes untreated, I guess if you're thinking very long term, there is an association with increased risk of type 2 diabetes and possibly with cardiovascular disease. And certainly a lot of women that we talk to are very aware of that, and they're very worried about that. So that's, I guess, good motivation to stick to the lifestyle changes. There is a slightly increased difficulty in getting pregnant. Now, we do know that women with PCOS do end up having a family of the same size as women without PCOS. So I think this is an important message to put out to all girls with PCOS who are worried about their fertility. You will be able to have children. It's just harder because you don't know when your periods are happening and you don't know when you're ovulating. So it's much, much harder to time it. Sorry, what was the original question again? Just remind me.
I just wanted to know what happens.
What happens if it doesn't get treated? Yeah. Another important thing, I guess, for all girls and women with PCOS to know is that if you're having very few periods a year, so that's only 3 or 4, it is recommended that you go on the oral contraceptive pill. This is so that you reduce the risk of endometrial cancer or cancer of the uterus. So that's why a lot of girls end up getting put on the pill. It's not necessarily for contraception, but it's for protection for harms in the future.
It sounds like, Carolyn, that early detection and treatment and lifestyle modification, if appropriate, is as applicable to PCOS as it is to many chronic health conditions. And so, but also recognising that, there could be some hesitation, or there might be some psychological anxiety around what is, the weight gain, what is PCOS. What would be the ways to encourage women to go forward and talk to GPs and get that early diagnosis and treatment? And what would happen in terms of, some of the challenges in navigating the health system if you don't do it early?
Yeah. So to that, there's a few things that I can suggest. So one is that clinicians do message, provide positive messages about PCOS. So lifestyle changes can have multiple benefits. So maybe emphasising the mental health benefits, which we know a lot about, both from diet and physical activity. Also emphasising that you don't need to, get back to a size 8 or, lose a lot of weight. Even if you lose 5% of your original body weight, that will have quite a lot of, positive benefits for your health overall. So, for your menstrual cycle, for your fertility, and for your symptoms of acne, and for your emotional well-being. In terms of navigating the health system, So Monash University have done quite a lot of work in this area. I wasn't involved, but I am aware of it. They've provided really useful consumer resources. There's a question prompt list that women can take to their GPs to ask about, do I have PCOS, and guide GPs to, what the tests are, and point towards their latest guidelines in terms of diagnosis, because diagnosis is actually reasonably complex. And I think it's a really great opportunity, I guess, to upskill our end users, or our patients, our consumers, to be empowered and to bring the information so that they get the diagnosis and treatment that they need. I mean, Kevin, I'm sure you know that, being a GP is incredibly difficult. You've got to be across so many changes in, all kinds of conditions. So, GPs should feel, I guess, grateful that they've been kept up to date by their patients.
Yeah, that's great.
Yep. Sorry, I was just going to say, Carolyn, you must see a lot of people who come to you in less than a perfect condition. What seems to be the thing that people have the most success with? Is there an approach to weight loss that you've seen that works better than others?
I don't think there is, Saxon. I think with something like this, and possibly with everything around weight loss, it does need to be what works for the individual. So, for example, for physical activity, there's lots of different types of physical activity that you could do. What I like to do might not be what, the person sitting in front of me likes to do. So I think it's important to, explore what it is that, each individual wants to do in terms of physical activity. You have the guidelines to aim to in terms of number of minutes of vigorous exercise, number of minutes of moderate exercise, and the strength training is important too. And then say, what would you like to do that you enjoy doing and that you can keep doing as well, because we're looking for sustainable changes. And they might say, look, it's rock climbing, or it's dancing, or I really like going to the gym. But, I couldn't really prescribe something to someone because they might just not actually ever want to do that.
I used to do a lot of rock climbing. It's lots of fun, but swimming laps or going for a run, it's just too boring. I just can't do it.
Exactly. Yeah. Whereas I love going for a run, so and I would, I'm terrified of rock climbing. So that, that doesn't work for me, but it doesn't matter as long as we're both being active.
Well, I'm too heavy to rock climb now. I need to find something else. I keep falling off.
Maybe to end on, Carolyn, you have a PhD. We like calling you a doctor, PhD in women's health, and you also have a blog site, which I love sharing with patients and our members, being The Healthy Doctor, focusing on wellness rather than sickness, which really aligns with our approach at Osana.
Yeah.
So thank you for doing that. Any practical tips you would like to leave our listeners with, especially in a COVID environment? Everyone's anxious, perhaps not doing as much as they would normally do with others. Your tips for women or just folks generally?
Yeah, look, I think that with over 20 years of being a doctor, I found that the real key to wellness is in your mind. There's so much that you can do physically. You can exercise, you can eat well, but if you're not happy and if you're not at peace with yourself, then that's really meaningless. And in fact, it's much easier to have a healthy lifestyle if you start off with being happy within yourself to start with. And I think one of the biggest things that I've learned as a person is how to be kind to myself, and starting with that attitude of self-compassion is really, really important. So that's something that I see a lot in patients who come and see me, the negative self-talk, and I'm calling it out and helping them, I guess, be kinder to themselves so that they're starting off with the right mindset, and then everything else seems to fall into place after that. So I think that would be my biggest tip, as everyone struggles with all the pressures of COVID, and your illnesses don't go away. There's worries about the future. Is to start with self-kindness.
That's a wonderful tip. So, well, thank you very much for coming on our podcast.
My
We
pleasure.
have lots of topics that we'd love to talk to you about in other episodes, and look forward to working together and raising awareness around some of these important topics, such as PCOS.
Caroline, tell us about the research you're doing in PCOS.
Yeah, thanks, Saxon. So I'm really interested in acupuncture research. I'm a fully trained Chinese medicine practitioner as well as a medical acupuncturist, and I do acupuncture all the time in my GP clinic. And I've been interested in the role of acupuncture for PCOS for a long time because there's some evidence that it might be helpful for things like insulin resistance. It certainly seems to be helpful for improving mental health symptoms such as anxiety. And it might have a really important effect on appetite suppression as well. So at the moment, I'm running a small pilot study out of Western Sydney University at Nickham Health Research Institute, and we're comparing two types of acupuncture against, I guess, usual lifestyle interventions. And we're seeing if, can we combine acupuncture with lifestyle interventions to get, a better effect overall on weight loss. And we're tracking things like heart rate variability to look at sympathetic tone and the effect on insulin resistance there. So, it's a very exciting space to be in, and hopefully, acupuncture might be a useful adjunctive treatment alongside, increasing physical activity and improving diet.
Any early results?
Not yet, no. We're only a third of the way into it, and it's just a pilot study. But yes, we hope to have results probably towards the end of next year.
And if anyone would like to participate, are there opportunities to join the trial or participate in future trials?
Yeah, absolutely. I can drop you a link. We're still screening women and hope to be reopening after the sort of COVID break in late November.
Wonderful. Thank you so much for sharing that, and look forward to chatting with you again, Carolyn.
My pleasure. Thanks.
Thank you.
Thanks, Carolyn.